Hello everyone, welcome to Pediatrics and Neonatology. This video is about epistaxis or nosebleed. The nose is an extremely vascular structure. In most cases, epistaxis or nosebleed is due to mild trauma to the anterior portion of the nasal septum, which is called kissel patch area. It is usually due to vigorous nose rubbing, nose blowing, or nose picking. If a patient has been using a nasal steroid spray, then check the patient's technique to make sure he or she is directing the nozzle at the lateral canthus of the eye and not the septum. If this does not reduce the nosebleeds, then the steroid spray should be discontinued. Now, examination of the kissel patch area usually reveal a red raw surface with fresh clots or old crust. Also look for telangiectasia, hemangiomas or varicosities. Less than 5% of the epistaxis is caused by a bleeding disorder such as von Willebrand disease. Now patient need a hematological workup if any of the following is present. A family history of a bleeding disorder. A medical history of easy bleeding, particularly with circumcision or dental extraction. Spontaneous bleeding at any site. Bleeding that lasts for over 30 minutes. Blood that will not clot with direct pressure by the physician. Onset before age 2 years. A drop in the hematocrit due to epistaxis. High blood pressure may rarely predispose to prolonged nosebleeds. Now, a nasopharyngeal angiofibroma may be manifested by recurrent epistaxis. Adolescent boys are affected most exclusively in this case, and CT scan of the nasal cavity and the nasopharynx is diagnostic. Now, the treatment of epistaxis. The following approach can be carried out in the office or offered as phone advice. The patient should sit up and lean forward so as not to swallow the blood, because swallowed blood may cause nausea and hematemesis, that is bloody vomiting, alarms the family. The nasal cavity should be cleared of the clots by gentle blowing, and the soft part of the nose is pinched firmly enough to prevent arterial blood flow. Pressure over the bleeding site is maintained for 5 minutes by the clock. But if bleeding continues, the bleeding site needs to be visualized. Now, a small piece of gelatin sponge, for example Jellofoam, or a collagen sponge such as Surgicel, can be inserted over the bleeding site and held in place by the parent. Now, friability of the nasal vessels can be decreased with daily application of water-based ointment by a cotton-tipped applicator. This lubricant is applied daily until 5 days have passed without a nosebleed, then weekly for 1 month. Now, twice daily nasal saline irrigation and humidification of the patient's bedroom may also be helpful. Now, aspirin and ibuprofen should be avoided, as should vigorous blowing of the nose. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.